I'm really pleased we've got 4 speakers to kick us off and to go through a few things. First of all, we've got Dylan Neal and McDerrick Bangpan from UCL EPPI Centre, who are going to give us an outline of the review that they've been undertaking of evidence relating to COVID and social capital. Then I'll be introducing you to Richard Harries, who's the Associate Director of the Institute for Community Studies. And then finally to Sarah Vibert, who's the Chief Executive of the National Council for Voluntary Organisations, the NCVO. We'll hear from all those speakers and then we'll open it up to discussion. There are two key questions we want to cover in the session. And that's the first is, what have we learned about how social capital has mitigated social harms in the last 24 months? And then secondly, how social capital can be utilised to better prepare for another crisis in the future. Okay, so first of all, I'm going to hand over to McDerrick and Dylan. You've got some slides, haven't you both? Share your screen with us?
Yes, I cannot share my screen now. Hold on a second. Can you see my, not yet. Can you see my slide?
Yep, that's perfect, thanks.
Hi, yes, thank you very much, Chris. Good morning and afternoon, everyone. Today, Dylan and I will be presenting the interim findings. I'm sorry, can you see? Interim findings of the work, a scoping exercise as the first stage of the systematic review, which aims to understand the nature of evidence relating to social capital during the COVID-19. As Chris said, we are based at the EPPI Centre, Evidence for Policy and Practice, and Coordinating Centre at UCL. Before we start the presentation, we would like to acknowledge our research team, including Lashi, Catherine, and Mei Hui, for their contributions for the work done so far. So before we're going to discuss the findings, I will briefly discuss how we navigate the literature looking at the concept of social capital and COVID-19. From the search, we search around 6 databases. We identify around 4,600 studies, of which we include around 800 studies for full text screenings. So the interim findings result we discussed in this session based on 50 studies, a snapshot of 50 studies after we screened full text. So we estimate that it represents around 10% of study that would have been included in the complete version of scoping exercise. From these 50 studies, we look at closely encoding to see how they answer the review questions. We identify broad trends of outcomes or key focus of literature exploring concept of social capital and economic outcomes, also in terms of health and well-being and social outcomes, which this outcome we will explore, talk about it later in the next few slides. And of these 50 studies as well, we are around 45% conducted in USA and the UK. And another set of study, around 45%, around 22 studies were conducted in Asia. And we can say that the majority of studies employ quantitative approach and were cross-sectional in nature. And we identify some studies use novel sources of data, for example, use of Google Maps or social networks, social medias to navigate the pattern of social capital and social behaviors. So now we're gonna dive into the key outcomes here. Dylan gonna talk about economic outcome and mental health outcome. Dylan.
Okay, thanks, Victoria. So we know the COVID pandemic led to an economic contraction across most sectors. And really what we're doing with this kind of question is to try and think through how social capital has helped to cushion the blow. And we're seeing a small number of the 50 studies that we've started to code that have explored economic outcomes and the relationship with social capital. We've had 3 studies that are looking at how businesses have formed proactive responses. Another study looking at how businesses have worked together to ensure supply chain resilience, how businesses have survived, and also how businesses are innovating and adapting to the changing climate. And social capital is being described in the different forms as well, so the way that businesses work together, the way that businesses reach out and work with local municipalities and local authorities, and the way that businesses reach out and work with their customers and employees. And so just to give a couple of kind of more in-depth examples, so to kind of give an idea of how social capital emerged during the pandemic. So focusing in first on a study by ING, which was looking at a case study in an area of Tokyo, looking at the way that innovation formed as a result of social capital. Here we saw that there were webs of informal relationships and interactions that functioned like small social innovation bubbles. And these webs superseded more formal organisations and networks between businesses within neighbourhoods. So social capital was formed in quite an innovative way during the pandemic, and it also involved businesses and local representatives working together. One innovative step that this neighbourhood in Tokyo took was for businesses to work together with local authorities to develop an app around which businesses were able to operate during the lockdown circumstances, which, for example, which restaurants were offering takeout services, and working together with assembly members and local authority members, businesses were able to develop this as an app, which was used, which had 21,000 views within the local area, so quite a popular app and formed through social capital. In another example, we had Rowan Smith, who studied GoFundMe pages, and really what they were trying to look at was the way that GoFundMe pages were keeping businesses afloat, the way that these campaigns were trying to tap into their existing social networks and trying to tap into new social networks and obtain additional social capital to keep their businesses afloat. They highlighted a variation really in the success of these campaigns. So for a small minority of campaigns, 11% of campaigns, they received no funding at all, but some of these campaigns were hugely successful. 3% of campaigns attracted over $40,000 worth of funding in this study of GoFundMe pages in New York City and California, some of which even attracted funding of over $100,000. And those campaigns that were found to be more successful were ones that were initiated by those closest to the business itself, so the owners, the employees and patrons. So they studied the profile really of what made for successful mobilization of social capital in this case. I think if we can move to the next slide. So the literature is also helping us to understand how social capital influenced mental health outcomes. And this is one of the most well-supported areas of evidence within the review so far. So within the 50 studies that we've looked at so far, 30% or 15 studies were exploring the relationship between social capital and mental health. Overwhelmingly, the studies that took on this research topic were adopting a more cross-sectional approach. So they were looking at kind of cross-sectional associations between indicators of social capital and mental health outcomes. So with some limited depth, but still we're seeing some very interesting patterns. As we go forward, we think that this body of literature is going to help us to examine the influence of different types of social capital. We're seeing some of these studies using composite measures, some using measures of social support, and a variety of other dimensions as well. Unsurprisingly, most of these studies, actually all of these studies so far, are suggesting that increased social capital is associated with better mental health. But the studies are also pointing towards differential effects according to different types of social capital. So one interesting study that we came across was a study by Chen and colleagues that was conducted early on in the pandemic, conducted in Wuhan in February 2020, so probably providing some of the first evidence around the social, psychological impacts of lockdown. So they conducted a study with 1,600 participants, and they were looking at how different forms of social support protected people from psychological distress triggered by the lockdown. And they saw that neighbourhood social support in particular was impactful in reducing forms of psychological distress, but other forms of social capital particularly from friends and relatives, had no impact, no protective impact in their particular study. And they attribute this to neighbourhoods becoming increasingly important in people's lives during lockdown. People were spending longer within their neighbourhoods because they were required to, but also they were organising as well along neighbourhood lines, as might be expected as well. And we've seen a similar pattern as well in other studies. So for example, a study by Brown and Reed looking at older people in the UK and their experiences of lockdown, again suggesting that older people were really relying on neighbourhood links rather than links with social friends and family to protect their mental health and improve their well-being. And I think it's back to you, McDerrick.
Yes, I'm going to talk about the other outcomes that emerged from the literature. So we also identify around 10% of the study looked at how the social capital may influence the spread of COVID-19 and death. Of this, 3 studies used international data sets from different countries to understand how different social factors, including social capital, explain excess death and the spread of COVID-19. For example, one study used a time series analysis to look at social capital defined as a trust, group affiliations, civic responsibilities, and confidence in public institutions, and try to link the data on COVID-19 death in 84 countries. The other set of studies also aim to explore the role of social capital, again defining as trust, social trust within the community, to how it might influence the health behavior change, and then it could explain the level of COVID-19 infection. For example, one study conducted in Italy investigated whether differences in social capital defined as trust and relationships within a community play a role in terms of level and growth rate of COVID-19 infection. For another set of study, we identify looking at how social capital influence health behaviors, including compliance to lockdown mandates or other health behaviors such as hand washing and social distancing, masking. And we found 2 studies conducted in USA aiming to explore how social capital defined as, again, social trust and political affiliations would be associated with vaccination perceptions and intention. And finally, as Dylan mentioned, we found around 9 studies or 10 studies explore how social capital has been developed or defined and been mobilized during the pandemic. The focus of this set of study looking at, for example, challenges of building support networks between families, children, and school during the pandemic to support well-being. And you can see this quotation from Brown and Reed that Dylan mentioned. The study aimed to explore experience of older adults in the UK in terms of how they utilize and drawing on the social capital within their community. So these types of evidence literature, a theme emerged from the literature we looked at as well. So reflections, Dylan, I'm going to talk about reflections and next steps.
Yeah, so as you might have gathered, it's early days. We're still screening the literature, and we focused in on these set of studies to provide an indication of the types of patterns that we're seeing. And we're really looking forward to hearing your reflections and hearing the discussion to help us shape the review and our thinking going forwards. So far, we're seeing that social capital is mobilised in different ways and has been studied using different theoretical and analytical frameworks. The bridging, bonding and linking frameworks that's prevalent within the literature isn't coming up that often in the studies that we're seeing so far. So we've got 4 studies that have used bridging, bonding and linking frameworks. But we're hoping to identify more. We're also seeing some gaps as well in terms of what we might have expected to see. So we're seeing gaps in terms of intervention evaluations in particular. So far, none of the 50 studies have evaluated an intervention that looked to strengthen or harness social capital during the pandemic. And we're also seeing gaps in terms of certain outcomes as well, for example, domestic violence which has been featured in the media. We're not seeing kind of interventions or observational studies around this. But supplementary searching may also help to plug some of these gaps as well, and maybe as well, hopefully some of the studies that may come through people may know of will also help to plug those gaps. The other kind of theme that's coming through is that this is a very international literature, and so it's really helping us to consider what the UK can learn from other settings. So we're at the point now where we're mapping out what the literature looks like in terms of social capital and its relationship with different outcomes, and then we're hoping to progress to a narrower question to review in more depth in a more detailed systematic review. We're really looking forward to hearing the discussion, but we'd also make a request as well. If you know of any studies or any work that's gone on in this area, we'd really like to hear about it. We'd really appreciate you getting in touch. So we've got our contact details at the end there as well. I think that's it. Thank you.
Thanks very much, both. Really, really helpful. Great start. It's some interesting reflections on that review that you've just started. I mean, the different dimensions of which social capital can play out in terms of its role on COVID and the outcomes of it. A kind of reliance, I think, within the UK on those international studies, reflecting perhaps a general concern about the lack of social science research during COVID and the impact it's had everywhere around the world, and the difficulties and challenges of that, and how we're kind of very dependent on a relatively small number of studies, but nevertheless some very innovative methodological studies there. But I think what those conclusions draw is that the importance of the locality and community and neighbourhood to the way social capital is mobilised is very interesting, which I think poses questions about how you scale it up or turn it into kind of policy interventions, which I think we'll come back to later. But let's turn to Richard. Thanks for joining us, Richard. Over to you.
Thanks, Chris. Yes, I'm Richard Harries. I'm Associate Director of the Institute for Community Studies. The Institute was launched in 2019 as a new kind of evidence centre, focused on what matters to local communities across the UK and dedicated to engaging with them to identify and prioritise the questions they have. In doing so, we seek to challenge the dominant model of research commissioning that is too often detached and extractive, answering questions set from above with little or no insight into what really matters to local people. And before I joined the Institute last year, I was Director of Research at Power to Change, the National Grant-Making Foundation for Community Businesses. Now, we've been set 2 exam questions for this session, and I'll try to cover both over the next 10 minutes. But before I do so, I want to step back for a moment and take a slightly longer view on the evolution of social capital as a potential tool for policymakers. 20 years ago, when I was a jobbing civil servant at the Home Office, I was asked to arrange for Professor Robert Putnam to come and talk about social capital to David Blunkett, then Home Secretary, and to his ministerial team. It was a great honour and a real insight into how to present social research in an attractive and persuasive way. To quote Putnam himself, his presentation had interocular impact. It hit you right between the eyes. Ministers and officials left the briefing with fire in their bellies and a real sense of mission to build social capital into the heart of the policymaking process. 10 years later, when I was a slightly more senior civil servant, working in the department that currently styles itself as the Levelling Up Department, I was asked once again to arrange for Robert Putnam to come and talk about social capital. This time to Eric Pickles, then Community Secretary, and to his ministerial team. Once again, Putnam gave a tour de force presentation, and once again, ministers and officials left the briefing with fire in their bellies. And yet I came away from this Groundhog Decade experience somewhat jaundiced. Now, to be fair, none of this was Robert Putnam's fault. His original analysis was and is sound, and his presentations were, as I said, excellent. The problem is that for over 2 decades now, policymakers have struggled to turn his academic insights into practical action. For all the talk of bridging, bonding and linking social capital that Dylan mentioned earlier, it's proven extremely difficult to translate these into policies that demonstrably make places better. And that last point, making places better, is critical. Whether it's the national strategy for neighbourhood renewal 20 years ago, or the current commitment to levelling up left behind places, the aim is to develop and implement policies that demonstrably make places better, with a clear causal link between intervention and outcome. I'll come back to this at the end, but let me turn now to some of the things that we've learned about social capital over the course of the pandemic and how they might be drawn on to better prepare for the next crisis. My comments are drawn primarily from research that the Institute completed last year for the Department for Digital Culture, Media and Sport. It's available on gov.uk if you'd like to read it in full. The report looks at local patterns of volunteering during the pandemic, and it's a nice mix of qualitative and quantitative analysis. Most of the evidence about social capital came from a programme of interviews and workshops with representatives from local councils, combined authorities, charities, community organisations, national funding bodies and volunteering platform providers. The research highlighted how volunteering in a crisis requires networks of individuals and organisations to work together. Communication, collaboration and trust, combined with the mutual cooperation and reciprocity that we all witnessed firsthand during the pandemic. This all pointed to the critical importance of social capital. Of course, research participants rarely use the actual words social capital. A typical quote from one council interviewee captures the spirit. There's something unique, they said, about local organisations. They press that button, SOS, and they have some pretty handy volunteers lined up. There's a level of trust, access, support that we haven't seen in any big infrastructure organisation. That quote captures, for me, a sense of the power of bonding social capital. And other interviewees talked in similar terms. One, for example, talked about the important role that churches played, supporting their congregations through the pandemic. There was also a powerful sense of linking social capital. To be fair, this was more likely in places where existing channels of communication were already strong across sectors. Nevertheless, where such networks and relationships developed between organisations, particularly those working at different geographical scales within the same location, it helped to ensure that effort was not duplicated. Indeed, this form of linking social capital was described by councils as critical to the success of their COVID-19 operating systems, particularly given the speed of organisational adaptation, the need to rapidly establish new services, and the vital importance of minimising duplication. What stood out by its absence, however, was any reference to bridging social capital, and I'd be interested to hear the views of others on this. Certainly in our research, it simply wasn't a significant factor raised by participants. I mentioned that the research also had a quantitative element, and I just want to come back to that briefly in light of the 5 other capitals that the government believes will drive its levelling up agenda between now and 2030. These are human capital, institutional capital, intangible capital, financial capital, and physical capital. Now, of course, all 6 capitals are interrelated, and the question we explored was whether the prevalence of mutual aid as an expression of social capital could be explained by levels of human, financial, or physical capital. Specifically, we compared the geographical distribution of over 4,000 mutual aid groups with levels of personal well-being, levels of GDP per capita, and with levels of community asset ownership. To cut to the chase, the only consistent match we found was between the number of mutual aid groups and the number of community assets in a region. And since the assets were there before the mutual aid groups, I'm willing to stick my neck out and suggest there may be a causal relationship there. And in one sense, this is not surprising. If people have a place to meet as a community, they're going to be more likely to form a mutual aid group. It speaks to the vital importance of social infrastructure as a potential generator of social capital. And it certainly suggests that a government interested in preparing for the next crisis might want to find ways to encourage even more community asset transfer. And in fact, that brings me back to the point I made at the start about the apparent lack of a clear causal link between policy interventions and outcomes, and how this has plagued the debate about social capital over the last 2 decades. Indeed, for me, more than anything, what the pandemic has shown is that social capital can be an incredible resource to draw on by communities themselves when addressing issues that matter to them. What worries me is the thought that somewhere in Whitehall, Michael Gove and his ministerial team have been attending briefing sessions and getting excited about how to build social capital into the heart of the policymaking process. Because while there are things that national and local government can do to build reserves of social capital in the good years, such as investing in social infrastructure, there remains a yawning evidence gap to suggest that social capital can be deployed instrumentally, top down, by government to deliver specific policy objectives. And nothing I've seen over the course of the pandemic convinces me otherwise. Thanks, Chris.
Excellent. Thanks ever so much, Richard. That's really good. At some point, could we put a link into the DCSF reports in the chat for everybody? That would be great.
I think Sarah already has.
Yeah, great, brilliant. Thanks ever so much for that. There's some interesting points there, clearly in the role of government and policymakers in where it might best put its efforts around social infrastructure rather than on kinds of the actual kind of delivery of social capital and growth of it. Let's move on to Sarah Vibert from the NCVO. Sarah, over to you.
Thanks very much, Chris. And thanks for that too, Richard. I think you and I agree on a lot of things, and there'll be some reflections similar to yours in what I'm going to say. So, hi, I'm Sarah Vibert. I'm the Chief Executive at the National Council for Voluntary Organisations. NCVO is a membership community for charities and voluntary organisations, and are here to support them across the country. And I mean, at its heart, voluntary action is about people making a difference, doing things in their communities or in communities of interest, which is, of course, part of generating and growing social capital. So really pleased to be invited to make some reflections. And I think it's really interesting how much NCVO and our partners are talking about social capital now, perhaps something we maybe weren't doing a few years ago. And I'm sure that's linked to levelling up, and also talking a lot more about social infrastructure. Which I just think it gives us a language to talk to government about what charities and volunteers do and the value they generate in society. So my reflection is going to be mainly about the role of charities and volunteers during the pandemic, their role creating social capital and what we've learned from this, and picking up on some of the findings that we've seen in the systematic review around things like mutual aid and the role of trust. So to start off by talking about voluntary organisations and charities specifically, and then I'll talk a bit more about volunteers. So the phrase that we used through the pandemic as NCVO was never more needed to describe the role of voluntary organisations and charities and community groups. And I think a lot of these roles were about creating bonding social capital, and I'd argue actually bridging social capital. We can maybe talk about that, Richard, in terms of responding to immediate needs. So whether that was about food, whether that was about loneliness, whether that was medicine delivery, but also more kind of indirect support. So as outpatient appointments were cancelled, for example, people looking to charities to help manage their long-term health condition. And we know that voluntary organisations are often trusted by communities in terms of local organisations, perhaps more sometimes than public services. And so we saw voluntary organisations playing roles such as encouraging vaccine take-up in particular communities. I think the other thing that was interesting was actually the voluntary organisations that didn't have this big stepping up role during the pandemic. So some charities just simply mothballed because of social distancing. So the theatres, the green spaces that were closed, the choir groups, the scouts that weren't meeting. And I think actually what that showed us is that if you take away an important part of our social infrastructure for a time, what that does and what impact that has, and perhaps shows the value of those in terms of social capital. We also saw that important linking role in terms of social capital. So obviously charities have an important role in raising issues, bringing people together to campaign. And we saw lots of kind of policy changes as a result. So whether that was funding for domestic abuse, ensuring people couldn't be evicted, groups that were pushing for the public inquiry. And then I think the other interesting thing that I'd pick up on from the systematic review is around fundraising being used to leverage and generate social capital. And the Charities Aid Foundation that found at the start of the pandemic, public donations increased by £800 million compared to the same period. Now, that didn't last throughout the pandemic, sadly. We're in a very different climate now, but I think it perhaps showed kind of people coming together wanting to do something at that very early stage. Picking up on some of Richard's remarks, I think what we did see is organisations, public sector and voluntary organisations working together more than ever before to address the needs of communities. And several local authorities in a recent piece of research we did commented on how the voluntary sector were able to bring that expertise and understanding. And we know in some areas that has continued, but we also know that it was in areas where there were those pre-existing relationships and these latent networks where that collaboration was able to happen more easily and more quickly. So I think they're kind of a clear learning in terms of the future. To talk a bit more specifically about volunteering, so there's a huge body of evidence around volunteering and social capital, given volunteering emphasises mutual cooperation, reciprocity, trust, network building. And COVID led to huge changes in volunteering, which I thought we're perhaps exploring briefly and then to come on to a couple of the learnings. So we saw this huge surge of people putting themselves forward to volunteer. And if you look at the Community Life Survey, you can see this huge rise in people getting involved informally. So that's the helping neighbours, mutual aid. And I know that some of the studies in the systematic review focus on mutual aid. And we know lots of people volunteered for the first time ever in the early stage of the pandemic. And so this brought different groups into that space, for example, younger people volunteering for the first time. But overall, while that informal volunteering went up, formal volunteering, so volunteering for an organisation such as a charity, actually went down. And a lot of that was because of social distancing and shielding. And we know now that organisations are struggling to bring that back. And I think, you know, the gap that that's creating is quite important to kind of consider. I mean, it's clear volunteers played a hugely crucial role in the pandemic. So those national coordinated schemes like volunteer responders, which provided that social connection for many people locally who otherwise wouldn't have had contact or wouldn't have had access to essential supplies. And then also the role that volunteers were able to play in things like the vaccination programme. So we've seen some big changes through the pandemic in who volunteers and how they volunteer. The role of digital in creating connections has obviously hugely accelerated. And we've also seen people wanting to volunteer in kind of small bite-sized chunks that fit around their life. And I think there's some really important learning for the future in terms of how we engage people. So we're doing lots of work now, creating a kind of future vision for volunteering, really looking at some of these learnings because we saw barriers to volunteering broken down, also new barriers created, and looking at what that means for the future. So in terms of a few kind of final remarks, I was going to kind of comment specifically on kind of digital trends and the acceleration of digital, because so much social capital is now being generated by digital means, whether that's through kind of local community WhatsApp groups or whether that's things like the big platforms like volunteer responders and being able to get involved in supporting people in the community. And I think this kind of begs massive questions about digital exclusion and what that means in terms of kind of, I guess, coal spots for social capital. Linked to that, I think, is we perhaps know, and there's research by New Philanthropy Capital that shows massive disparities in terms of where charities are. And so if you look at the Southeast, there's 2.1 charities per 1,000 people, but that falls to 1.4 in the Northeast. And so if you're looking to kind of generate social capital in places where perhaps social capital is already lower and not having charities as a vehicle to do that. I think the other thing that our recent research around kind of the impact of the pandemic on volunteering and voluntary organisations has been, I think it's to some extent accelerated this trend towards more community-led and more community power models. And I think that kind of, I guess it starts to sort of touch on some of the things that Richard was saying really around kind of top-down approaches to creating social capital and whether they actually work. And certainly I think there's some kind of big questions for more traditional voluntary organisations around how do you involve people and how do you involve volunteers. And yeah, something we saw a lot during the pandemic was how informal and formal approaches to building social capital can work alongside each other. So for example, in those places where mutual aid and local authorities worked really well, but there can also be big tensions there. And something we saw as well was kind of a bit of a national local tension around government running schemes such as volunteer responders, and then what the kind of reaction to that from kind of the more locally based grassroots community organisations. I'll leave my remarks there. Looking forward to the conversation. Thanks
very much, Sarah. That was also very excellent too. Some really interesting points made there, particularly around the nature of volunteering and the changes in that. Also very interested in that point about the regional kind of disparities in where charities are and where that support, where that social infrastructure might exist. I'm very keen to get people to contribute to this. A couple of people have put comments on there, so I'm going to very harshly ask you to say something. So Neil Denton, you said you were talking about the relationship building project you're involved in. Maybe you'd want to share that with us.
Okay, yeah, cheers. So yeah, I'm Neil. I'm an independent community mediator, but also a professor in practice with the After Disasters Network at Durham. The Relationships Project, we think, have been doing some excellent work. They set up what they call the Observatory, so bringing in people from all parts of community just to go, what's going on? And really early on, we saw that incredible surge of human kindness, which we see in every disaster we've ever studied. But also particularly for this one, an increase in bonding, but a decrease in bridging capital. Now, partly that's because we were keeping each other safe by keeping each other separate. And therefore those everyday interactions dropped. But also as a disaster goes on, when we acknowledge that communities have different needs, that can turn into competition and also animosity in terms of who's keeping us safe, who's not. Yeah, we thought what would help. So we've tried to create a toolkit or Bridge Builders Handbook for communities, which we're now in a really rough way piloting with lots of different people across the UK and Nigeria. And yeah, it seems to resonate with people that what we see, although we've had bonding, that can turn into competition and alienation. And where attempts around linking capital have been made by states where there aren't strong bridging relationships, again, that creates competition and animosity between communities. So yeah, some really interesting stuff happening, particularly.
That's really helpful, Neil, because what you flagged there, of course, is how we might take it for granted that social infrastructure, social capital and bonding is inclusive, but not always. And of course, there is. We've talked about digital exclusion as well. Sarah mentioned that in terms of how some people then are kind of removed from the support and benefits that social capital can bring. And so those relationship building is quite presumably very central to mitigating some of those issues. Any other comments or questions people wish to bring in? Yeah, Richard, go back to you.
Yeah, Chris, I'm very happy to come back to this point about linking social capital, and it'd be interesting to hear what McDerrick and Dylan have to say about it, given that I think Dylan said that there hadn't been much in the literature on it, but certainly, obviously, the old research canard applies that the absence of evidence doesn't imply the evidence of absence. So, you know, in our project, linking social capital simply wasn't a factor that was discussed in the interviews. That's not to say that it wasn't important, but clearly, I think, as Neil and others have said, that the kind of the focus on neighbourhood has been really reflected in bonding social capital. And there was another point that Dylan made earlier on that I'm sure it's only just a kind of a passing comment, but I didn't want it to go completely unchallenged as it passed, which was, he talked about, I think it was, I can't remember where the study was from, but he said, in Japan, social capital emerged, he said, to do it. I think that's not the best way to conceptualize social capital. Social capital is always there. It's how it's deployed, you know, and who sees it. And I think that's really important. And I do think there's something quite important as well in the specific role of social infrastructure as a generator of social capital. I think that's something that's definitely worth coming back to. You know, the phrase social capital occurs about half a dozen times in the Levelling Up white paper that the government produced, and largely interchangeably with social capital, but they are different concepts. And I think some greater conceptual clarity there would be useful.
Thanks, Richard. I'm also going to try and introduce Tom to the conversation as well. Tom Griffiths you've been in the chat as well, talking about particular around data and method as well. Tom, do you want to say a few things?
I'd be pleased to. A little bit of a problem with digital connection where I'm living. If I flicker, I might have to go on to blind. Yeah, I'm just leading a very small action-based quality research project in Yorkshire. I've done previous stuff on a small-scale basis to do with human trafficking and modern slavery, and it's how we can get a piece of this pie. Really, I'm raising here. I know there's very big research initiatives, and I'm not criticizing them, but they primarily use quantitative analysis and have lots of administrative backup and support to do it. On a small scale basis, I've got 10 or 11 community researchers, hardly heard voices, different communities going out there listening, and we're going to feedback on it. How can that sort of approach tap in to the sort of mega stuff that you've been doing, both internationally and nationally? Because I think that's the way forward. I do think some of these quantitative analysis research approaches in Britain over the last 20 years have actually been damaging and hurtful because of sideline local voice, sideline local participation, and left them fraught and frustrated once these researchers disappear to careers elsewhere. I'm not scathing at all of research, but I think it needs to consider how the best way to engage with local people is done so effectively.
Yeah, really good question. I'm going to invite my UCL EPPI colleagues to respond to this. Obviously, it's a very important point, because if we end up excluding particular kinds of research from the reviews, we're going to end up with particular kinds of conclusions. So McDerrick, do you want to respond to that?
Yes, thank you, Chris and Tom and Visha. So first point on the data, I totally agree in terms of from the data literature we investigating, the majority of studies are using quantitative approach in terms of understanding association between social capital, some kind of how they conceptualize it and the outcome. So less so in the qualitative study. The small amount of study we found when we looked at the full text and the data, I agree that they give the rich data to understand how the social capital being perceived by the local people, by participants. So in terms of strategy for systematically, we're not excluding any qualitative study, but from this scoping exercise, we start searching on the big databases first. So we plan to do some kind of gray literature to find small qualitative study that not being published in the public domains or biographical database. So that's a part of the work. So I hope that we can find the small, rich data to complement the quantitative studies. And going back to the concept of the social capital, I think, as we said, I think that the BFAD is it has been conceptualized in different ways, and many literature didn't name social capital in their studies. They use the terms like engagement, social support, and other themes that come a lot in terms of social support in the literature. And we, at this stage, we try to capture the different, variety, how they conceptualize, and then we might be able to group them or make it clear in terms whether it's about bonding, linking, or bridging in terms of the ways that we talked about it here. So that were my comments. Dylan, you want to add more?
Not really. I think you covered it all. Just to kind of emphasize that the small number of studies that use the terms kind of bonding, bridging, and linking, it's just the way that the authors kind of interpret or use a kind of particular analytical framework, but we're seeing lots of kind of variation, and so we'll have a job really of trying to categorize these kind of different forms ourselves. And yes, just to say that probably emerging wasn't the best choice of word really to describe the social capital. It was more of a reconfiguration. I think it was, it was taking on a different form as a result of the pandemic. So yeah, I agree with that kind of comment as well.
Thanks very much, both. Neil, if you wouldn't mind, I'm just going to move on to something else because we've only got about 5-10 minutes left. So I just want to talk about the relationship between the voluntary organisations, community organisations, and local authorities, and bring that back in. Sarah mentioned it in her talk about where there were strong relationships already that really benefited in terms of the response to COVID. I've got a couple of questions about that. Is it generally the case that those local authority links there can be very useful? Do they enhance what if you like civil society can provide? Secondly, then well, if they are dependent on existing infrastructure, how do some local authorities have those good relationships in the first place, and what can be practically done to kind of improve that elsewhere? Yeah, Richard.
I'm very keen to come on this, Chris, but I'm conscious of time, so I'll keep it very short. I mean, suffice to say, when I was working in government during the austerity years, I would have lots of conversations with local authorities about how, there was a recognition that they needed to work with communities in a different way. There was lots of sort of nodding around the table that it was important, but no one quite wanted to take that final leap into the dark, because of course it's scary, and if things go wrong, it's not the community that gets into the neck, it's the councillor or the council officer. And so, people always just step back from the cliff edge and try to do it. But just like the pandemic forced us all to work online, it also forced councils to work with communities in a new way. And they loved it. I mean, you talk to authority. Deborah Cadman, I had a great conversation with her last year. The experience of seeing that communities can self-organise and can work collaboratively with the council has been a revelation, and lots of local authorities are really interested in how they can keep that going, because they see it as it could be the next major phase of public service reform, actually.
Sarah, do you want to come back in on that as well?
Yeah, I'm happy to build on that. I mean, I think what was really interesting, actually, I think one of the things that was really instrumental in changing relationships was the relaxation of public procurement commissioning rules, which just meant it just cut all the red tape and meant you could just get on with working together. And of course, they've now been changed back to kind of pre-pandemic. And I think in some cases, relationships have gone back to pre-pandemic, but that's not universal. As I said in my talk, those who were able to kind of capitalise on the relaxation of the commissioning rules were the ones that were already talking to the local authorities quite regularly. I also think there's something important about the role of local voluntary sector infrastructure as well, which funding has been slowly eroded from local voluntary sector infrastructure, and so it's no means universal across the country anymore. But where it's strong or where it still exists, there's quite an important role there to play that kind of almost bridge between the voluntary sector and the local authority. There's also been some interesting research by Pro Bono Economics in the last few weeks that's come out about attitudes of policymakers towards the voluntary sector, and particularly looking at local councillors, and just, I guess, the level of misunderstanding about what voluntary sector organisations can do. So there's quite a lot of understanding that they probably can do stuff in the kind of well-being social services space, but a lot less understanding about the role in terms of things like job creation and more kind of economic measures. So I think there's kind of a lot of work to do there, just around kind of just building understanding about the role of the voluntary sector, particularly locally.
Great. I just last few minutes for further comments. I'm particularly interested in the role of other institutions and organisations, and I include the families in that, and I include higher education institutions, the education system in that as well. Any other thoughts or comments? Neil, do you want to go? I mean, we can go back to your point as well, if you had your point earlier.
Yeah, I mean, I've tried to articulate it in the chat, but I'm working on a mobile and a tiny keyboard, so it's tricky. Yeah, just to respond to Richard, there might not be much in the literature, but in reality, I've seen huge pushes, possibly in a response to mutual aid emerging, possibly in what Sarah's been talking about and what we've been calling new power or old power dichotomies, but this huge push around co-design, co-delivery, asset transfer, etc. And yeah, I'm a practitioner, not an academic, so I'm on the ground in disasters, and I've been to a few, and every time I see this, where there aren't existing bridging relationships, where we don't start to understand the power of difference and use that energy in a positive way, it creates competition, it decreases resilience, and it doubles our problems on the ground. So it's you don't build a bridge in the middle. And increasingly I see states trying to improve their arguments and their sense to say we just need to build a better bridge from our side. But if you're not looking at the foundations from the other side, your bridge falls down.
That's a really good analogy, Neil. So thanks for sharing that with us. We're going to be going back to the main session now, so I'll leave you to join to the main session by pressing on the lead breakout room, or it will automatically happen in now 40 seconds. Thank you very much for your time, everybody. Much appreciated.
Thanks, Chris.
Thanks,
Bye.
Richard, and thanks, Sarah, and Dylan and McDerrick. Thank you.